Hi, everybody. Week four. Week four is here, and we are doing headache today because it keeps cropping up with. Ooh, is it going to let me do it? There we go. Whether it's migraine, whether it's tension headaches, dehydration, side effects from chemo, fatigue, headaches come up a lot in my office. And you all mentioned it a couple of times, so I thought it was a good one to do week four. I also think personally, anytime there's like a holiday weekend, I feel like everything just comes at you on the Monday after holiday weekend. So it's a good protocol to just send everything down and relieve any tension that you might have from, I don't know, sitting in front of your inbox for too many hours. All right. So for those of you that are new, welcome. My name is Jackie LaCava. I'm an acupuncturist. I work in Phoenixville. I've been part of Unite for Her for, gosh, I think it's been 10 years now. And I started with week one talking about acupressure. And these are a little bit out of order. So it starts with this. I found this research article and I started giving it to my patients and having them apply it. And they found that it was really helpful. And then that started a whole process of, well, I can give acupressure homework to patients for various conditions while they're in treatment, after treatment. And it's helpful, similar to how a physical therapist would send you home with home exercises. The good thing about acupressure is that you can use it anywhere. You can use it when the symptoms are happening. You can use it while you're sitting, getting an infusion, in the car, on your way to or from. If you're having trouble sleeping, before you go to bed, when you wake up in the morning, it's just nice that you can do this daily outside of the acupuncture treatment room. The original protocol in the research is on this slide. So the points are written there. There's a QR code directly to the study. And then there's also a visual of the points on the study. So if you want to start right from the very beginning, this is the slide I put in every week. This is where everything started for me. Acupressure itself, my rules are: find a place that you're comfortable, find a position that you're comfortable in. Some weeks I've been sitting at my desk. Today I'm sitting at a table. Last week I was sitting on the floor because that was more comfortable. Whatever is more comfortable for you. Some patients are lying on their bed and then they can put their feet up to get to certain points that are down low, or that's more comfortable. You'll find what's comfortable for you. You want to put direct pressure on the point. It's come up in previous weeks. You don't want it to be too heavy or too light. So I don't want you to bruise yourself with the amount of pressure that you're using. However, you might feel a little bit of an ache or a tingliness with some of the points, depending on where we're pressing. So slight ache, tingliness is fine. Feeling like it's really painful and uncomfortable and you're gritting through it, not fine. If you have lymphedema, you want to do light enough pressure that you're not causing significant pitting or anything like that. You can do acupressure over your garments if you wear garments, but you don't want to use, the rule is not using heavy, super heavy pressure if you have active swelling. Okay. Pressure about 1 to 2 minutes per point. That's what I've been doing here. I think the original research article was longer. I think it was 3 to 5 minutes, but that's a long time. And I found that 1 to 2 minutes per point is fine. I go left to right because I'm left-handed. You can go right to left. The rule is if it's a point that's on both sides of the body, you just do acupressure on one side at a time. Okay, it's different from acupuncture, but it really allows you to focus on the point on one side at a time. Another thing I brought up was other things you can use besides a finger. So you can use an eraser. This one's got a pretty good end to it. If you've got a flat razor, don't use the sharp edge. Try to get like one of those nubby things that fit on there. I've used that too. If you've got swelling or something like that, it might be more comfortable. But you can use this as like an extension of your finger on different points to get an even pressure. I've also found it helpful if you have joint pain. Sometimes it's easier to grip this, or I've had patients wrap it in a washcloth so that it's got a looser grip, and then you can use it. That way you don't have to use your finger, and you don't have to give yourself joint pain by not being able to have more of a grippy wrist, if that makes sense. So you can make it a thicker handle press. Treatments are done every day, once per day. Now that's a general rule. I think a couple weeks ago when we were doing the protocol for nausea, I think I said, this is one of those things where use it when you need it. You certainly can do it preventatively, but I find that most of the time people are using it when they actually have the symptoms. I would say that this week is another one of those weeks where you would use this protocol when you have a headache, when you feel like a headache's coming on, versus using it preventatively on a weekly basis. Any questions with that before we get into it? Let me see if, no, awesome. Okay, if anything pops up, I'll answer it as it comes up. Okay, we talked about this slide. All right, so each week I'm taking this protocol, so these points, and I'm modifying it a little bit. I would say that today is probably the most modified that we've done. Really, it's taking most of the points away from the rest of the body. So we're not doing any lower points. It's focusing a lot on points on the face, points on the neck, upper shoulder, and then we're ending with a point on the hand. So it's a really good protocol if you can only be seated. Or if you're like sitting back in an infusion chair, you can get to everything for the most part. If you don't have a port and you have like an IV in one of the hands, just don't do acupressure on that hand while the IV is active. It's a little too much. Okay, so we're going to start with a point at the top of the head. So for me, I've got a ponytail like right at the crown of my head. So you're coming right up at the top of the head, center. It's called do 20. And you can press with one hand. And I am adjusting myself. Feet flat on the ground if you're seated, back all the way, resting on the back of the chair, nice and comfy and supported. And we're going to press. I'm pressing like down like this. So like that. You can also use a pencil eraser for sure. Usually there's like a little bit of a tender spot. The other thing I'll say with this one, let me just get a time going. It can feel a little lightheaded inducing. That's normal to get that kind of like almost dizzy feeling. I feel like that's how it is when it's active. But it should not stay once you've taken your hand away and we've moved on to other points. So this is a point where I wouldn't have somebody do acupressure standing. If that makes sense. And I'm using steady pressure, and I'm just, with this point, I feel like the channel follows down the spine and it roots down at your tailbone. So there's this feeling of settling down along the spine and an energetic movement down towards the tailbone, down towards the ground. And when you have a headache, we think of that as energy going up when it should be going down. So all of these points have a downward movement. The next point I want to move to is Taiyang. So that is if you go to the end of your eyebrows and then you go here. So if you come up, so there's end of the eyebrows, there's like a little nook directly from the eye over. It's like a little divot. And we're going to press, you can press one side, do the other side. You're coming eyebrow, eye. It's like right there. Steady pressure. You can use your thumb too if that's more comfortable. Steady pressure. Now this one you might feel like kind of spreads along this area. It is one of those ones where I sometimes do like a circular movement on it. And if you find it's better to do both at the same time, by all means. But I'm just going to do one at a time. I'm going to switch to the other side. It's the same thing. You're going into the nook at the end of the eyebrow. Pressing right there. I was relaxing to that one. I wasn't paying attention. We're going to switch from Taiyang. So do 20. Taiyang. Then we're going to go to Yin Tong. So all the way in the center. And you've done, if you've been with us together since the beginning, you know this one. It's right in the middle of the eyebrows. And this one tends to spread out this way. I think, as I've said in previous weeks, if you find your mind thinking about a million different things, just try to bring it back to the point and how you feel with having the point pressed. And then as we move out from this point in a minute, we'll just be moving out this way. But for now, we're just pressing straight here. Okay, so now bladder 2, neck pop. Bladder 2 is right at the edge of the points. As we come up, we're right there. And when you feel in there, this one is one of the ones that sometimes feels a little bit tingly with people. There's a little nerve that comes out there, and sometimes it can feel like it's making a headache a little bit worse. You also might feel it coming down the back here or down into the nose here. It's got a little pathway that comes and connects from the other channel to this one. We're going to switch to the other side. And like before, you can also use this if that's more comfortable. Sometimes it is. Sometimes, especially if you get hot flashes or things like that, a hot, sweaty finger is not comfortable on the face. Whereas something like this, that feels a little bit cooler, is more comfortable. Okay, now we're going to, stuck to the chair. We're going to move away from the front of the face, and we're going to come to the back of the neck. So gallbladder 20 is, let's see if I can turn, if you can see that. So coming down, there's like a the nape of your neck comes down, and there's like, this is the trapezius, so this chunk is coming down. And then you have like a little triangle that's made here. So sorry, it's my hair. You have a little triangle that's made here. You're going right into that nook. When we were doing On Mian, which is in that original protocol, we were going here. So instead of going here, you're going a little further, right in here. Close, similar, for sure. This is one where sometimes a thumb might work. If you really want to lean into it, you can certainly use this, but I don't know if I like that. It's a little small. I also have some people who like a golf ball. You can just roll it right up in there. That's fine too. Usually, if you have the type of headache where you get upper back tension, when you're dehydrated or lower blood sugar, you can get tension here too. Premenstrually, for sure. And again, if it's more comfortable, do both at the same time. It's fine. Mm-hmm. Okay, I'm going to switch to the other side. It's the same thing. You're coming up. Around this way. So behind the ear, coming right up in here. And finding the tender spot. It's definitely more tender on me. Even if it's not the exact right spot, there's another point there that's also, it's a very similar indication. So that's fine. Okay. Now, the last two. So one's up here and one's at the hand. So with this one, you're taking, so there's this here. This is the top of the shoulder. You're going halfway between the top of the shoulder and this little angle here. Right in the center. Right there. That's an easy way to do it. There we go. Get out of the way here. There we go. So you see you've got shoulder point, nook, halfway in between, right, back a little bit. So you can see, like right back in there, that spot. So it's back just slightly. You'll feel like a belly of a muscle. It's usually a little bit tender. You're just pressing on that. This one, there we go. It's got a good neck pop. This one, more than all the other ones, we use all the time for a downward movement. You may feel tension running up the neck, down your upper back, sometimes into here. All of that's normal. That's where the channel, the gallbladder channel, is going. I'm going to switch to the other side. So let me get that out of the way. It's warm up here. So going down the nook, this little angle here, point of the shoulder, and then you're going halfway in between, and you're just scooping back off the clavicle, so you're not on a bone, you're right in a muscle. And then if I'm doing it to myself, I'm holding it, it's really sore. Now I'm feeling tension run up this way, more so than anything else. Sometimes you can feel a little ball there. What was I saying? I like to hold it this direction. You can also use this as well. Or if you're holding like a ball or something, you can also put the ball there and do that way. It's also a good one if you have a partner or a friend who can do a neck massage, having them focus on that can also feel good. Okay. The last point is large intestine 4. So on the hand, going halfway between this metacarpal, going right there. Now this one, I usually do acupressure with my thumb, and then I press it like I have in the picture there. It's like a circular kind of motion toward the bone. You can certainly do that. You can also just do steady pressure. It's also another one that if you need to, you can use a pencil. Now, every time I do this acupressure protocol, it probably more than any of my other ones needs to be tweaked a little bit for the individual. So see how this jives with you. And then at the end, if we have a minute, I would just want to talk about modifications. I'm just holding this here. And then let's switch to the other side. So you can go like this. I'm doing the same thing halfway in between. Now, with this, as you come back to center, I will say headaches are a little bit like snowflakes. They're all a little bit different with each person. So we did this protocol top to bottom. Some people, they have to do it the opposite direction. So if you find it's helpful, you can do this protocol the opposite. So doing hand to here, to here, to here, to here, Taiyang, do 20, okay? And end here. People that are in an active headache, you might find that's more helpful. Try it both ways, see if that works. Another thing that some people, which is not in this protocol, but that some people need is the addition of liver 3, which is a foot point, which I won't acupressure that now, but if you go into, I think, yeah, week 3. So liver 3 is right here. So you could add that to the protocol if you need a little bit more grounding. But Let's see how this does for you, active, not active. And then, of course, feel free to give me feedback next week, and we can talk about modifications or in the chat, and then we can talk about them next time too. I think those are all your questions, Rachel. Yes, thank you. Okay. Anything, we've got 2 weeks left, and I ask this every time, but is there anything that people really want covered the last 2 weeks? Feel free to put them in the chat, and then I can compile them. I'm thinking next week will probably be hot flashes, night sweats, sleep, joint pain. I'm between the three. On which? Arm pain, pit pain. Yeah, we could talk about that. We could do joint pain and then talk about different areas and points. That's a good point. All right, I'm going to see how I can work those 3 things in. All right. Thank you, everybody. It has been really great being here on Mondays. I will be back next week, same time. Looks like I've got a medley of things I need to put in for next week, so let's make it happen. But in the meantime, have a wonderful week and stay dry.